Okay, so the causes of mouth ulcers can be quite varied. One of the commonest causes is trauma or traumatic injuries, so just from biting and inadvertently injuring the area of the mouth. Sometimes that can be from thermal injuries, so eating something too hot, or chemical injuries, so from putting substances next to an area of the mouth that causes a chemical injury. They can also be infective, so you can commonly have viral things like cold sores and herpes type infections. They can be inflammatory, so aphthous ulcers are something that people often complain of, where they get crops of ulcers that rotate around their mouth and move. There are rarer causes like vesicular bullous disorders, pemphigus, pemphigoid. They're really uncommon. And then the most serious one to bear in mind is oral cancer can present as an ulceration. And that's really the one that's most of concern that we're trying to exclude whenever we see a patient with ulcers. Okay, so mouth ulcers, the term ulcer literally means a breach in the lining, so a breach in the oral mucosa. They can be sore and painful. In fact, if they're painless, those are generally the more worrying ones. The cancerous ones tend to be painless more often than not. Depending on the cause, so if they're aphthous ulcers, for example, you can get short little crops of ulcers that rotate around the mouth and never last for more than 7 days. I think the take-home message for this question is that persistent ulcers that stay for longer than 2 weeks in a single spot really do need urgent investigation. So one of the key things to diagnose the cause of the mouth ulcer is inspection. I look in a lot of mouths and look at a lot of ulcers, so I get good at recognizing patterns. So sometimes the clue is just in looking at them, and aphthous ulcers have a particular appearance, cancerous ulcers have a particular appearance. For some ulcers, we'll do a biopsy, so take a little portion of the ulcer or the skin alongside it and send it off for analysis. For certain inflammatory ulcers, we'll do blood investigations for underlying deficiencies and anemia. And then I'll often ask patients and whether they have coexisting ulceration anywhere else in their body or skin lesions, because that can also give me a clue as to an underlying cause. So mouth ulcers are treated in different ways depending on what the cause is. So for example, if they're infective, then you need to have the antiviral treatment or antibacterial treatment that's required. If they're inflammatory, so sometimes it's just symptomatic things, so avoiding things that precipitate them, topical creams, ointments, might be steroid, might be antibiotic mouth rinses, sometimes immunosuppressant drugs in unusual circumstances. Sometimes it's a change in medication. So some medications that patients might already be on will be causing ulceration and they might need to be changed. And obviously, if they're cancerous, then those ulcers are going to be needed to be treated more often than not, surgery and or chemoradiotherapy. But the key with those is making a diagnosis early and getting to the right person. Benign ulcers, like inflammatory ulcers, are more of a nuisance than anything else. And one of the main problems with them is nobody knows what the underlying cause of recurrent aphthous ulceration, for example, is. They can cause issues with maintaining oral hygiene, and they can become infected themselves and cause further problems. And those are probably the complications, as it were, of the benign types of ulcers. So for benign things, it's possibly identifying any dietary precipitants, any allergies to particular foods. Sometimes it's components in toothpaste. Sometimes it's just by trial and error. Sometimes patients can have formal allergy testing to things so that we can try and pick things up and avoid them. Stress for recurrent aphthous ulceration is a big thing. So there's studies and evidence to support the association of stress with ulcers. So anything that can be done to control that might remedy it. A good diet. So sometimes we find deficiencies in people with aphthous ulceration. So trying to make sure that the diet's well balanced can be helpful. Talking about cancerous ulceration, the two main risks for oral cancer are smoking and alcohol. And so smoking cessation and reducing or avoiding alcohol consumption are clear winners in terms of making sure that you keep your chances to a minimum of developing that problem.